Enteral Site Management. Welcome to 5MOLE, 5 Minutes of Learning. Our objectives are to simplify and streamline clinical tasks, promote learning, gather feedback to enhance our content to better meet your needs. Please follow the feedback link provided. Visit Learn Something New today. Share one key takeaway from this video. Your feedback is highly valued and helps us improve our learning resources. What are enteral sites? Enteral means through the GI tract. These are locations where nutrition, or enteral feeding, is delivered directly via a tube when oral intake is impossible. Main types include gastrostomy, or G-tube into the stomach, duodenal feeding into the duodenum when the stomach isn't suitable, and jejunum feeding into the middle small intestine, often for high-risk patients. Jejunum feeding rates are typically slower to optimize feed absorption. NICE promotes infection prevention control measures. Professionals must promote cleanliness and prevent infection. Always perform hand hygiene with soap and water before and after all clinical tasks. Put on fresh gloves before touching or cleaning the tube site. Clean site with gauze and saline or warm water. Monitor site for infection signs, redness, swelling, pain, discharge, or odor. Be aware of patient allergies when providing care. Dry the GI site thoroughly, applying prescribed creams as needed. Record the site's condition, cleanliness, correct tube positioning, and safe feeding practices. Tube migration is when an enteral feeding tube moves from its correct position to another location in the GI tract. Signs include feed pooling in the mouth, changes in external tube length, feeding intolerance like vomiting, coughing, difficulty flushing the line, or unexpected pain. Serious migration risks include aspiration, inadequate nutrition, internal organ injury, or tube blockage or leakage. If tube migration is suspected, do not use the feeding tube until a qualified healthcare professional confirms tube position. If tube is blocked, gently flush tube with warm water. If tube remains blocked, gently aspirate with a syringe and attempt to flush as before. This process takes approximately 30 minutes. If fail, then escalate to GP or 111. General assessment before using GI tubes. What type of enteral tube is being used? For example, PEG, NG, jejunostomy. Date of insertion. Any complications or concerns or the site is healing as expected. The care plan must include professional responsible for replacing or checking the tube, and how often does the tube need to be replaced? Are activity restrictions placed on exercise, sleeping positions, placement of the tube? Is the GI tube being flushed appropriately before and after feeds and medication? Has all care given been accurately documented? Caution: practice within your scope. If uncertain about feeding plans or administration, seek guidance from a qualified clinical professional. Patient safety is paramount.